The death of Iganga woman MP Kaudha Hailat has shocked health rights activists.
When we see a death like the death of the MP, I think it's very absurd. And it's a point of concern. We should actually begin waking up if we have not been waking up on this death.
Moses Murumba, the executive director of an NGO called the Center for Health, Human Rights and Development, forced the government for failing to meet the Abuja Protocol, which it ratified in 2001.
Health budget has been stagnant. 6, 7, we haven't jumped 8. Now, this is very different from what we see in roads and energy. It's been 18 over the last 5 years. It's jumped to 24 plus. Now, when you unpack even the 6 and 7 that has been allocated to the health sector, you actually find out that the government's contribution to that is slowly reducing down. Challenge is, we have continued to look at investing in health as expenditure in health. If you don't make a distinction between an investment and an expenditure, I think you get it wrong. We invest in our people. If you lose an MP, that's an investment that is lost, rather than looking at it as spending on the person that is important.
Koboko woman MP Margaret Babadiri is a long-time activist for better health care and maternal health in Uganda's parliament.
This challenge is very common in Koboko. In Koboko, I would say even in a month you cannot fail to hear that a woman has died during delivery because of the problems I've mentioned earlier. Transport to health centers when the mother wants to deliver.
Babadiri says the death of the youthful Iganga woman MP is another thorn in her flesh.
Like in the districts, transport, they are providing ambulances without fuel. And the woman in labor or the husband must provide for the transport.
A recent survey on maternal health indicates that out of 1,000 pregnant women, 350 get pregnancy complications, while 16 women die every day during pregnancy.
Maternal death can only be dealt with a functional public health system. Unfortunately, we continue to witness that the investment that is coming into the public health system is not actually sufficient to deal with maternal death. Any functional health system of the country is measured on the extent to which it can be able to actually respond to the maternal health needs of its citizens.
Currently, the Center for Health, Human Rights and Development has filed about 23 cases in the course of law relating to maternal health.
Since we've been filing these cases, we have had 5 judgments, and we have never lost a judgment on decisions on the right to health, which for me is a fantastic sign that these rights are actually there and the rights are capable of being enforced. It's been more of citizens waking up to take these cases before court.
Murumba says Ugandans need to rise up and defend health as a fundamental human right.
We have a Supreme Court judgment which says that provision of maternal health could actually have some human rights issues which the Constitutional Court needs to look at.
Jingo Francis, NTV.